So my next guest is Satya Alumalai, CEO and founder of Adar Health. Come on up, Satya.
Hey,
Hey, good to see you.
good to see you. Thank you.
Happy to have you on the studio, but you're no stranger to the spotlight. You were just on Good Morning America, right?
Yeah, that was a fun experience.
I'm sure there was a
actually.
few more lights, a few more staff.
Yeah, but having around you is also great because Startup Health is like home, right?
That's right, that's right. So you are CEO, founder of Adar Health, and you've brought with you your product, which is called MouthLab, correct?
Yeah, it's actually a rapid health assessment device that measures more than 10 vital health parameters in just 30 seconds,
Okay.
non-invasively.
Okay.
This is more for monitoring and managing chronic disease patients at home. But more importantly, we just want to give a new kind of personalized experience for patients with chronic condition so that they can make sustainable behavior changes, not just by using a wearable, but also by using a device just once a day. So
Okay.
it's more like a check engine light for
Let me
humans.
see it.
Yeah.
Let me see it. Okay, so here's the device, beautifully designed. Looks like an iPhone for home monitoring. It's got. So let's say I'm a patient with a chronic disease, and I'm prescribed this, or I purchased it off the shelf. What's my experience like? When do I use it? How do I use it?
So, I mean, it's a very simple device. So what we really wanted to do is like pair one habit with another habit. So essentially like every single day in the morning when somebody brushes their teeth, they can literally pick this device, put it in their mouth, breathe through normally.
To breathe into it.
And then towards the end, you perform lung function test or spirometry, which is essentially like breathing in and breathing out.
Okay.
And then once you're done, you just treat it like a toothbrush. You just wash it under tap water, put it back. Because the device actually has an IoT kit within,
Okay.
It communicates via 4G. So if you don't have a smart device, or you don't have to take your smart device into the bathroom and just use it anywhere in the world.
Okay. So I have this with me. I breathe into it. I just breathe in and out a few times, once a day.
Yep.
And where does that information get collected? What happens to it?
Yeah, the data is actually sent to our secure HIPAA-compliant cloud. From there, the data is sent directly to the patient's phones. But if the patients require, like they can send it to their caregivers and also to their care providers. When I say care providers, they have our own dashboard which they can use, but we can also send it to the EMR. So which is what we are working towards, like integrating everything into one place, or more like unifying all the aspects of patient's health in one place.
Got it. I'm sure that's one of the big challenges, that integration process.
Exactly.
I mean, you've already conquered this incredible feat with the technology, which I understand this is pretty proprietary. This is pretty new. And then now you have the step of integration.
Yeah.
It's also challenging.
Exactly. I think every process is challenging for us. Even building this device, it took like almost 10 years now.
Of course, yes.
Right now, the challenge of integrating is just a smaller challenge for us. But more importantly, we are working towards getting our regulatory clearances. So once we get there, then it'll be a much more easier thing for us to approach. And we have great partners in Johns Hopkins, LifeBridge Health, and other partners like Mayo, which we are talking to right now. So integration is going to be really something that can be done through our partnership. And imagine in healthcare, nothing can be done alone. Like we need an army.
Yeah, exactly,
Right?
exactly. So 2019 was a big year.
Yep.
These incredible partnerships, you have the product, you're on Good Morning America, you're getting consumer attention, and I think people are seeing this for what it is, really a really dramatic shift in how we could do in-home monitoring. So tell me, what are you looking forward to for 2020?
So 2020 is going to be one of the most amazing years for us because we are looking for our regulatory clearances. But more importantly, we wanted to use this year and use our product to show that there's more to measuring health than just like having a Fitbit or an Apple Watch, because like a lot of the cases, like chronic disease patients like don't use devices these days, and they rely on going back to the hospital. And healthy individuals just think like, okay, hey, I'm totally fine, I exercise, I eat well, but I don't take care of myself. Yeah. So what we aim to do is like to really do more studies to show that like a multi-parameter or a multi-biomarker approach, which we show through our device, would be phenomenal and essential for everyday consumers to use our device. So all we really want is like spend 1 minute of your day to get a comprehensive health assessment sent directly to your phone, so that you don't have to keep looking at it, so that you can treat it more like as I said, like a check engine light for humans. So 2020 is a year for us to display and then show to the world. And we're really looking forward to working with Startup Health and the army of entrepreneurs.
Awesome. Well, this is inspiring to me. I love hearing your story. Anyone who wants to hear more about Satya and Adar Health, we did a piece in Startup Health Magazine, issue number 4.
Yeah.
And so you can check it out. He's got a great story. So Satya, thanks for joining us. I hope you have an awesome rest of the festival, and have a good afternoon.
Thank you. Appreciate it.
All right.
Great.
Take care.